NCLEX-RN Challenge Exam Questions Free NCLEX PN Practice Questions with Answers. Question 1. Which of the following sounds is distinctly heard on auscultation over the abdominal region of an abdominal aortic aneurysm client? Here are the options. Option A, brute. Option B, crackles. Option C, dullness. Option D, friction rubs. The correct answer is option A, brute. A systolic brute is a vascular sound heard over an aneurysm caused by the turbulent flow of blood through the dilated area. Question 2. Which of the following groups of symptoms indicated a ruptured abdominal aneurysm? Here are the options. Option A, lower back pain, increased BP, decreased RBC, increased WBC. Option B, severe lower back pain, decreased BP, decreased RBC, increased WBC. Option C, severe lower back pain, decreased BP, decreased RBC, decreased WBC. Option D, intermittent lower back pain, decreased BP, decreased RBC, increased WBC. The correct answer is option B, severe lower back pain, decreased BP, decreased RBC, increased WBC. A rupture presents with sudden severe pain and signs of hemorrhagic shock, decreased BP, decreased RBC count, and an elevated WBC count due to stress. Question 3. Which of the following complications of an abdominal aortic repair is indicated by detection of a hematoma in the perineal area? Here are the options. Option A, hernia. Option B, stage 1 pressure ulcer. Option C, retroperitoneal rupture at the repair site. Option D, rapid expansion of the aneurysm. The correct answer is option C, retroperitoneal rupture at the repair site. A hematoma in the perineum or scrotum or flank ecchymosis suggests that blood is leaking into the retroperitoneal space from the surgical site. Question 4. Which hereditary disease is most closely linked to an aneurysm? Here are the options. Option A, cystic fibrosis. Option B, lupus erythematosus. Option C, Marfan's syndrome. Option D, myocardial infarction. The correct answer is option C, Marfan's syndrome. Marfan's syndrome is a connective tissue disorder that weakens the structural integrity of the aorta, significantly increasing the risk of aneurysms. Question 5. Which of the following treatments is the definitive one for a ruptured aneurysm? Here are the options. Option A, antihypertensive medication administration. Option B, aortogram. Option C, beta-adrenergic blocker administration. Option D, surgical intervention. The correct answer is option D, surgical intervention. A ruptured aneurysm is a life-threatening emergency. Immediate surgical repair is the only definitive treatment to stop hemorrhage. Question 6. Which of the following heart muscle diseases is unrelated to other cardiovascular diseases? Here are the options. Option A, cardiomyopathy. Option B, coronary artery disease. Option C, myocardial infarction. Option D, pericardial effusion. The correct answer is option A, cardiomyopathy. Cardiomyopathy is a primary disease of the heart muscle itself and is often not a result of other conditions like CAD or MI. Question 7. Which of the following types of cardiomyopathy can be associated with childbirth? Here are the options. Option A, dilated. Option B, hypertrophic. Option C, myocarditis. Option D, restrictive. The correct answer is option A, dilated. Peripartum cardiomyopathy is a form of dilated cardiomyopathy that occurs in late pregnancy or the first few months following delivery. Question 8. Septal involvement occurs in which type of cardiomyopathy? Here are the options. Option A, congestive. Option B, dilated. Option C, hypertrophic. Option D, restrictive. The correct answer is option C, hypertrophic. Hypertrophic cardiomyopathy often involves asymmetric septal hypertrophy, which can lead to left ventricular outflow tract obstruction. Question 9. Which of the following recurring conditions commonly occurs in clients with cardiomyopathy? Here are the options. Option A, heart failure. Option B, DM. Option C, MI. Option D, pericardial effusion. The correct answer is option A, heart failure. Structural changes in the heart muscle, regardless of the type of cardiomyopathy, eventually lead to the heart's inability to pump effectively, resulting in heart failure. Question 10. What is the term used to describe an enlargement of the heart muscle? Here are the options. Option A, cardiomegaly. Option B, cardiomyopathy. Option C, myocarditis. Option D, pericarditis. The correct answer is option A, cardiomegaly. Cardiomegaly literally translates to enlargement of the heart. Question 11. Dyspnea, cough, expectoration, weakness, and edema are classic signs and symptoms of which of the following conditions? Here are the options. Option A, pericarditis. Option B, hypertension. Option C, obliterative. Option D, restrictive. The correct answer is option D, restrictive. Restrictive cardiomyopathy presents with symptoms of congestive heart failure due to the heart's inability to fill properly during diastole. Question 12. Which of the following types of cardiomyopathy does not affect cardiac output? Here are the options. Option A, dilated. Option B, hypertrophic. Option C, restrictive. Option D, obliterative. The correct answer is option B, hypertrophic. In the early stages of hypertrophic cardiomyopathy, cardiac output is often maintained, though it may be compromised later if an obstruction develops. Question 13. Which of the following cardiac conditions does a fourth heart sound S4 indicate? Here are the options. Option A, dilated aorta. Option B, normally functioning heart. Option C, decreased myocardial contractility. Option D, failure of the ventricle to eject all blood. The correct answer is option C, decreased myocardial contractility. An S4 sound atrial gallop is produced when the atrium contracts against a stiff, non-compliant ventricle, often seen with decreased myocardial contractility. Question 14. Which of the following classes of drugs is widely used in the treatment of cardiomyopathy? Here are the options. Option A, antihypertensive. Option B, beta-adrenergic blockers. Option C, calcium channel blockers. Option D, nitrates. The correct answer is option B, beta-adrenergic blockers. Beta blockers are used to decrease heart rate and oxygen demand, allowing for better ventricular filling and reducing symptoms. Question 15. A 23-year-old client has substernal chest pain and a heart rate of 136. Breath sounds are clear. Which drug should the nurse question the client about using? Here are the options. Option A, barbiturates. Option B, opioids. Option C, cocaine. Option D, benzodiazepines. The correct answer is option C, cocaine. Cocaine is a potent sympathomimetic that causes rapid tachycardia, vasoconstriction, and myocardial ischemia, leading to substernal chest pain. Question 16. Which assessment finding would strongly suggest that a painless breast lump is cancerous? Here are the options. Option A, eversion of the right nipple and mobile mass. Option B, non-mobile mass with irregular edges. Option C, mobile mass that is soft and easily delineated. Option D, non-palpable right axillary lymph nodes. The correct answer is option B, non-mobile mass with irregular edges. Malignant masses are typically hard, fixed to surrounding tissue non-mobile, and have poorly defined or irregular borders. Question 17. A 35-year-old client with vaginal cancer asks about the usual treatment. Which treatment should the nurse name? Here are the options. Option A, surgery. Option B, chemotherapy. Option C, radiation. Option D, immunotherapy. The correct answer is option C, radiation. External beam or internal brachytherapy radiation is the most common primary treatment for vaginal cancer. Question 18. A biopsy report classifies a lesion as TIS, NCO. What does this classification mean? Here are the options. Option A, no evidence of primary tumor or metastases. Option B, carcinoma in situ, no abnormal regional lymph nodes, and no distant metastases. Option C, can't assess tumor or nodes. Option D, carcinoma in situ with ascending degrees of distant metastases. The correct answer is option B, carcinoma in situ, no abnormal regional lymph nodes, and no distant metastases. TIS stands for tumor in situ surface layer only. N0 means no lymph node involvement, and M0 means no distant metastases. Question 19. When teaching a client how to care for a neck stoma after a laryngectomy, which instruction should be included? Here are the options. Option A, keep the stoma uncovered. Option B, keep the stoma dry. Option C, family must perform all care. Option D, keep the stoma moist. The correct answer is option D, keep the stoma moist. Maintaining moisture in the stoma is essential for wound healing and prevents the drying of secretions that can lead to airway obstruction. Question 20. Which type of cancer causes the most deaths in women? Here are the options. Option A, breast cancer. Option B, lung cancer. Option C, brain cancer. Option D, colon and rectal cancer. The correct answer is option B, lung cancer. While breast cancer is more common, lung cancer remains the leading cause of cancer-related mortality in women. Question 21. Antonio with lung cancer develops Horner's syndrome. When assessing for symptoms, the nurse should note, here are the options. Option A, meiosis, partial eyelid ptosis, and anhidrosis on the affected side. Option B, chest pain, dyspnea, and cough. Option C, arm and shoulder pain with atrophy. Option D, hoarseness and dysphagia. The correct answer is option A, meiosis, partial eyelid ptosis, and anhidrosis on the affected side. Horner's syndrome is a triad of symptoms: drooping eyelid ptosis, constricted pupil meiosis, and lack of sweating anhidrosis caused by nerve interference. Question 22. Vic asks the nurse what PSA is. The nurse should reply that it stands for. Here are the options. Option A, prostate-specific antigen, which is used to screen for prostate cancer. Option B, protein serum antigen. Option C, pneumococcal strep antigen. Option D, Kappa-nucleospecific antigen. The correct answer is option A, prostate-specific antigen, which is used to screen for prostate cancer. PSA is a protein produced by the prostate gland. Elevated levels can indicate inflammation, benign enlargement, or prostate cancer. Question 23. What is the most important postoperative instruction after a subarachnoid block spinal anesthesia? Here are the options. Option A, avoid drinking liquids until the gag reflex returns. Option B, avoid eating milk products for 24 hours. Option C, notify a nurse if you experience blood in your urine. Option D, remain supine for the time specified by the physician. The correct answer is option D, remain supine for the time specified by the physician. Remaining supine flat prevents the loss of cerebrospinal fluid through the puncture site, which helps prevent a postspinal headache. Question 24. A male client suspected of having colorectal cancer will require which diagnostic study to confirm the diagnosis? Here are the options. Option A, stool hematist. Option B, carcinoembryonic antigen CEA. Option C, sigmoidoscopy. Option D, abdominal computed tomography CT scan. The correct answer is option C, sigmoidoscopy. Direct visualization via sigmoidoscopy or colonoscopy allows for a tissue biopsy, which is the only way to definitively confirm cancer. Question 25. Which finding most strongly suggests that a woman has breast cancer? Here are the options. Option A, slight asymmetry of the breasts. Option B, a fixed nodular mass with dimpling of the overlying skin. Option C, bloody discharge from the nipple. Option D, multiple firm, round, freely movable masses. The correct answer is option B, A fixed nodular mass with dimpling of the overlying skin. Skin dimpling resembling an orange peel and a fixed, immovable mass are characteristic indicators of invasive breast cancer. Question 26. A client with cancer is being evaluated for possible metastases. Which of the following is one of the most common metastases sites? Here are the options. Option A, liver. Option B, colon. Option C, reproductive tract. Option D, white blood cells WBCS. The correct answer is option A, liver. The liver is a primary site for metastases for many cancers because of its large size and rich, double blood supply. Question 27. During an MRI scan to rule out a spinal cord lesion, which of the following would pose a threat to the client? Here are the options. Option A, the client lies still. Option B, the client asks questions. Option C, the client hears thumping sounds. Option D, the client wears a watch and wedding band. The correct answer is option D. The client wears a watch and wedding band. MRI uses a high-powered magnet. Metal objects like watches or wedding bands can be pulled toward the magnet or cause thermal burns. Question 28. Which of the following teaching points about preventing osteoporosis is correct? Here are the options. Option A, obtain an X-ray every 3 years to detect loss. Option B, avoid strenuous exercise. Option C, the RDA of calcium may be found in a wide variety of foods. Option D, RDA of calcium requires taking a supplement. The correct answer is option C. The RDA of calcium may be found in a wide variety of foods. Calcium is widely available in dairy, green leafy vegetables, and fortified foods. Dietary intake is the preferred method of prevention. Question 29. Before Jacob undergoes arthroscopy, which finding is a contraindication for this procedure? Here are the options. Option A, joint pain. Option B, joint deformity. Option C, joint flexion of less than 50%. Option D, joint stiffness. The correct answer is option C, joint flexion of less than 50%. Arthroscopy requires the joint to be maneuverable. If the client cannot flex the joint to at least 50%, the scope cannot be safely inserted. Question 30. During a routine checkup, Nurse Marion assesses a male client with acquired immunodeficiency syndrome AIDS for signs and symptoms of cancer. What is the most common AIDS-related cancer? Here are the options. Option A, squamous cell carcinoma. Option B, multiple myeloma. Option C, leukemia. Option D, Kaposi sarcoma. The correct answer is option D, Kaposi sarcoma. Kaposi sarcoma is the most frequent malignancy associated with AIDS, presenting as purple or brown skin lesions caused by human herpesvirus 8. Question 31. Ricardo is scheduled for prostatectomy, and the anesthesiologist plans to use a spinal subarachnoid block during surgery. Why does the client require special positioning for this type of anesthesia? Here are the options. Option A, to prevent confusion. Option B, to prevent seizures. Option C, to prevent cerebrospinal fluid CSF leakage. Option D, to prevent cardiac arrhythmias. The correct answer is option C, to prevent cerebrospinal fluid CSF leakage. Proper positioning and remaining supine post-procedure are necessary to prevent CSF leakage through the dural puncture, which can result in a severe spinal headache. Question 32. A male client had a nephrectomy 2 days ago and is now complaining of abdominal pressure and nausea. The first nursing action should be to. Here are the options. Option A. Auscultate bowel sounds. Option B. Palpate the abdomen. Option C. Change the client's position. Option D. Insert a rectal tube. The correct answer is option A. Auscultate bowel sounds. Postoperative abdominal pressure and nausea may indicate paralytic ileus. Auscultating for bowel sounds is the first assessment step to evaluate gastrointestinal motility. Question 33. Wilfrida with a recent history of rectal bleeding is being prepared for a colonoscopy. How should the nurse Patricia position the client for this test initially? Here are the options. Option A. Lying on the right side with legs straight. Option B. Lying on the left side with knees bent. Option C. Prone with the torso elevated. Option D. Bent over with hands touching the floor. The correct answer is option B. Lying on the left side with knees bent. The left side lying Sims position is used initially for colonoscopy because it follows the natural anatomy of the sigmoid colon, easing the insertion of the scope. Question 34. A male client with inflammatory bowel disease undergoes an ileostomy. On the first day after surgery, the client's stoma appears dusky. How should the nurse interpret this finding? Here are the options. Option A. Blood supply to the stoma has been interrupted. Option B. This is a normal finding 1 day after surgery. Option C. The ostomy bag should be adjusted. Option D. An intestinal obstruction has occurred. The correct answer is option A. Blood supply to the stoma has been interrupted. A dusky, pale, or purple stoma indicates impaired tissue perfusion or ischemia and is a surgical emergency that must be reported immediately. Question 35. Anthony suffers burns on the legs. Which nursing intervention helps prevent contractures? Here are the options. Option A. Applying knee splints. Option B. Elevating the foot of the bed. Option C. Hyperextending the client's palms. Option D. Performing shoulder range of motion exercises. The correct answer is option A. Applying knee splints. Splinting joints in a functional or extended position helps prevent the shortening of skin and connective tissue contractures during the healing process. Question 36. Nurse Ron is assessing a client with 2nd and 3rd degree burns on the face, arms, and chest. Which finding indicates a potential problem? Here are the options. Option A. Partial pressure of arterial oxygen PaO2 value of 80 mmHg. Option B. Urine output of 20 ml/hour. Option C. White pulmonary secretions. Option D. Rectal temperature of 100.6 degrees F 38 degrees C. The correct answer is option B. Urine output of 20 ml/hour. Normal urine output should be at least 30 ml/hr. An output of 20 ml/hr in a burn patient suggests inadequate fluid resuscitation or impending acute kidney injury. Question 37. Mr. Mendoza has suffered a cerebrovascular accident CVA and is too weak to move. To help the client avoid pressure ulcers, Nurse Celia should. Here are the options. Option A. Turn him frequently. Option B. Perform passive range of motion ROM exercises. Option C. Reduce the client's fluid intake. Option D. Encourage the client to use a footboard. The correct answer is option A. Turn him frequently. Repositioning the patient at least every 2 hours is the most effective nursing intervention to relieve pressure and prevent skin breakdown. Question 38. Nurse Maria plans to administer dexamethasone cream to a client who has dermatitis over the anterior chest. How should the nurse apply this topical agent? Here are the options. Option A. With a circular motion to enhance absorption. Option B. With an upward motion to increase blood supply. Option C. In long, even outward and downward strokes in the direction of hair growth. Option D. In long, even outward and upward strokes opposite the direction of hair growth. The correct answer is option C. In long, even, outward, and downward strokes in the direction of hair growth. Applying topical medications in the direction of hair growth helps prevent irritation of the follicles, folliculitis, and ensures even distribution. Question 39. Which class of medication protects the ischemic myocardium by blocking catecholamines and sympathetic nerve stimulation? Here are the options. Option A. Beta-adrenergic blockers. Option B. Calcium channel blocker. Option C. Narcotics. Option D. Nitrates. The correct answer is option A. Beta-adrenergic blockers. Beta blockers block the effects of catecholamines like adrenaline, decreasing heart rate and myocardial oxygen demand, which protects the heart after an MI. Question 40. A male client has jugular distension. In what position should the nurse place the head of the bed to obtain the most accurate reading of jugular vein distension? Here are the options. Option A. High Fowler's. Option B. Raised 10 degrees. Option C. Raised 30 degrees. Option D. Supine position. The correct answer is option C. Raised 30 degrees. Jugular venous distension JVD is most accurately assessed with the head of the bed elevated at a 30 to 45 degree angle. Question 41. Which class of medications maximizes cardiac performance in clients with heart failure by increasing ventricular contractility? Here are the options. Option A. Beta-adrenergic blockers. Option B. Calcium channel blocker. Option C. Diuretics. Option D. Inotropic agents. The correct answer is option D. Inotropic agents. Positive inotropic agents such as digoxin increase the strength of the heart's contractions, thereby improving cardiac output in heart failure patients. Question 42. A male client has reduced HDL and elevated LDL levels. Which of the following dietary modifications is not appropriate for this client? Here are the options. Option A. Fiber intake of 25 to 30 g daily. Option B. Less than 30% of calories from fat. Option C. Cholesterol intake of less than 300 mg daily. Option D. Less than 10% of calories from saturated fat. The correct answer is option C. Cholesterol intake of less than 300 mg daily. For clients with high-risk lipid profiles, dietary cholesterol should be limited to less than 200 mg daily. 300 mg is the limit for the general healthy population. Question 43. A 37-year-old male was admitted with acute MI. Which of the following actions would breach the client's confidentiality? Here are the options. Option A. Verbal report to the telemetry nurse before transfer. Option B. Notifying the on-call physician about a change in condition. Option C. ED nurse checks the latest ECG results to check the client's progress. Option D. At the client's request, the nurse updates the client's wife. The correct answer is option C. ED nurse checks the latest ECG results to check the client's progress. Hospital staff who are not currently assigned to the patient's care have no legal right to access the patient's medical records or test results. Question 44. During a pause in compressions, the cardiac monitor shows narrow QRS complexes and HR of 70 with a palpable pulse. Which action should the nurse take first? Here are the options. Option A. Start an IV line and administer amiodarone. Option B. Check endotracheal tube placement. Option C. Obtain an arterial blood gas ABG sample. Option D. Administer atropine 1 mg/L.V. The correct answer is option B. Check endotracheal tube placement. When a pulse returns ROSC during advanced life support, confirming a patent and correctly placed airway ET tube is the first priority for stabilizing the patient. Question 45. Alvin with a massive pulmonary embolism will have an ABD perform. The acid-base disorder that may be present is? Here are the options. Option A. Metabolic acidosis. Option B. Metabolic alkalosis. Option C. Respiratory acidosis. Option D. Respiratory alkalosis. The correct answer is option D. Respiratory alkalosis. A pulmonary embolism causes hypoxia, which leads to hyperventilation. The excessive loss of CO2 results in respiratory alkalosis. Question 46. Armand is admitted with a pneumothorax and a chest tube is inserted. Bubbling appears in the water seal chamber. Which is the most likely cause? Here are the options. Option A. Air leak. Option B. Adequate suction. Option C. Inadequate suction. Option D. Kinked chest tube. The correct answer is option A. Air leak. Continuous bubbling in the water seal chamber indicates an air leak, either in the patient's pleural space or within the drainage system itself. Question 47. Postoperative client receives 3,000 ml of Ringer's lactate over 24 hours. The drop factor is 10. How many drops per minute? Here are the options. Option A. 18. Option B. 21. Option C. 35. Option D. 40. The correct answer is option B. 21. Calculation. 3,000 ml x 10 GTT/24 hours x 60 min equals 30,134 for 40 equals 20.83, which rounds to 21 drops per minute. Question 48. Miki is ordered digoxin Lanaxin 0.12 mg. The bottle contains 0.5 mg in 1 ml. What amount should the nurse administer? Here are the options. Option A, 1.2 ml. Option B, 2.4 ml. Option C, 3.5 ml. Option D, 4.2 ml. The correct answer is option B, 2.4 ml. Calculation: 0.12 mg/0.05 mg/ml equals 2.4 ml. Question 49. Nurse Alexandra teaches a client about elastic stockings. Which statement indicates the teaching was successful? Here are the options. Option A, I will wear the stockings until the physician tells me to remove them. Option B, I should wear the stockings even when I am asleep. Option C, every 4 hours I should remove the stockings for a half hour. Option D, I should put on the stockings before getting out of bed in the morning. The correct answer is option D, I should put on the stockings before getting out of bed in the morning. Elastic TED stockings should be applied before the client gets out of bed, while the veins are less congested and the legs are least swollen. Question 50. The primary reason for rapid continuous rewarming of the area affected by frostbite is to. Here are the options. Option A, lessen the amount of cellular damage. Option B, prevent the formation of blisters. Option C, promote movement. Option D, prevent pain and discomfort. The correct answer is option A, lessen the amount of cellular damage. Rapid rewarming in water 104-108 degrees F helps to quickly restore blood flow and stop the freezing process, which minimizes cellular death and tissue loss. Question 51. A client asks how hemodialysis will take the place of his kidneys. Hemodialysis works by. Here are the options. Option A, passing water through a dialyzing membrane. Option B, eliminating plasma proteins from the blood. Option C, lowering the pH by removing non-volatile acids. Option D, filtering waste through a dialyzing membrane. The correct answer is option D, filtering waste through a dialyzing membrane. Hemodialysis uses the principle of diffusion to move nitrogenous waste products and excess electrolytes from the blood across a semi-permeable membrane. Question 52. A client with AIDS tells the nurse that he has been exposed to measles. Which action by the nurse is most appropriate? Here are the options. Option A, administer an antibiotic. Option B, contact the physician for an order for immune globulin. Option C, administer an antiviral. Option D, tell the client that he should remain in isolation for 2 weeks. The correct answer is option B, contact the physician for an order for immune globulin. Immune globulin provides passive immunity and can prevent or modify measles in an immunocompromised person if given shortly after exposure. Question 53. A client with MRSA is on contact precautions. Which statement is true regarding these precautions? Here are the options. Option A, the client should be placed in a room with negative pressure. Option B, the door may remain open. Option C, the client should wear a mask at all times. Option D, infection is prevented by hand washing, gloves, and a gown. The correct answer is option D. Infection is prevented by hand washing, gloves, and a gown. Contact precautions are designed to prevent transmission by direct or indirect contact. Required PPE includes gloves and a gown when entering the room. Question 54. A client with an above-the-knee amputation tells the nurse that his foot hurts and itches. Which response indicates an understanding? Here are the options. Option A. The pain will go away in a few days. Option B. The pain is due to peripheral nervous system interruptions. I will get you some pain medication. Option C. The pain is psychological. Option D. The pain and itching are due to infection. The correct answer is option B. The pain is due to peripheral nervous system interruptions. I will get you some pain medication. Phantom limb sensation is a real physical sensation caused by nerve endings in the stump sending signals to the brain. It requires pharmacological management. Question 55. A client with cancer of the pancreas has undergone a HIPAA procedure. During this procedure, the doctor removes the. Here are the options. Option A. Head of the pancreas. Option B. Proximal third section of the small intestines. Option C. Stomach and duodenum. Option D. Esophagus and jejunum. The correct answer is option A. Head of the pancreas. The Whipple procedure pancreatic duodenectomy involves the removal of the head of the pancreas, the duodenum, part of the jejunum, and the gallbladder. Question 56. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should avoid. Here are the options. Option A. Packed fruits. Option B. Salt. Option C. Fresh raw pepper. Option D. Ketchup. The correct answer is option C. Fresh raw pepper. Neutropenic patients should avoid raw produce and certain spices like fresh pepper, as they can harbor high levels of bacteria and mold. Question 57. A client is discharged home with a prescription for Coumadin sodium warfarin. The client should be instructed to. Here are the options. Option A. Have a PRO-time done monthly. Option B. Eat more fruits and vegetables. Option C. Drink more liquids. Option D. Avoid crowds. The correct answer is option A. Have a PRO-time done monthly. Patients on warfarin must have their prothrombin time patient or international normalized ratio INR checked regularly to ensure the dosage is therapeutic. Question 58. The nurse is assisting with the removal of a central venous catheter. To facilitate removal, the nurse should instruct the client to. Here are the options. Option A. Perform the Valsalva maneuver as the catheter is advanced. Option B. Turn his head to the left side and hyperextend the neck. Option C. Take slow, deep breaths as the catheter is removed. Option D. Turn his head to the right while maintaining a sniffing position. The correct answer is option A. Perform the Valsalva maneuver as the catheter is advanced. The Valsalva maneuver increases intrathoracic pressure, which prevents air from entering the central circulation air embolism as the catheter is withdrawn. Question 59. Before administering streptokinase, the nurse should assess the client for. Here are the options. Option A. A history of streptococcal infections. Option B. Allergies to pineapples and bananas. Option C. Prior therapy with phenytoin. Option D. A history of alcohol abuse. The correct answer is option A. A history of streptococcal infections. Streptokinase is derived from streptococci. A recent strep infection can result in high antibody titers that may neutralize the drug or cause an allergic reaction. Question 60. A 43-year-old African American male is admitted with sickle cell anemia. Which of the following outcome criteria would the nurse use to assess circulation in the lower extremities? Here are the options. Option A. Body temperature of 99 degrees F or less. Option B. Toes moved in active range of motion. Option C. Sensation reported when soles of feet are touched. Option D. Capillary refill of 3 seconds. The correct answer is option D. Capillary refill of 3 seconds. Capillary refill is a direct assessment of peripheral tissue perfusion. In sickle cell anemia, vaso-occlusive crises can impair circulation, making refill time a critical metric. Question 61. A 30-year-old male is brought to the emergency department in sickle cell crisis. What is the best position for this client? Here are the options. Option A. Side lying with knees flexed. Option B. Knee chest. Option C. High fowlers with knees flexed. Option D. Semi-fowlers with legs extended on the bed. The correct answer is option D. Semi-fowlers with legs extended on the bed. Flexing the knees or hips during a sickle cell crisis can further impede already compromised blood flow. Keeping the legs extended helps maximize circulation. Question 62. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of the highest priority? Here are the options. Option A. Taking hourly blood pressures with mechanical cuff. Option B. Encouraging fluid intake of at least 200 ml per hour. Option C. Position in high fowlers with knee gatch raised. Option D. Administering Tylenol as ordered. The correct answer is option B. Encouraging fluid intake of at least 200 ml per hour. Hydration is the primary intervention for sickle cell crisis to reduce blood viscosity and prevent further sickling of red blood cells. Question 63. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat to assist with recovery? Here are the options. Option A. Peaches. Option B. Cottage cheese. Option C. Popsicle. Option D. Lima beans. The correct answer is option C. Popsicle. Popsicles provide both comfort and much-needed hydration, which is essential for a patient in a vaso-occlusive crisis. Question 64. A client is complaining of severe pain in his feet and hands during a sickle cell crisis. The pulse oximetry is 92. Which intervention would be implemented first? Here are the options. Option A. Adjust the room temperature. Option B. Give a bolus of Roman 4 fluids. Option C. Start O2. Option D. Administer meperidine demerol 75 mg Roman 4 push. The correct answer is option C. Start O2. Oxygenation is the priority ABC when the pulse oximeter shows hypoxia 92% and the patient is experiencing sickling, which is triggered by low oxygen. Question 65. The nurse is instructing the client with iron deficiency anemia on dietary choices. Which meal plan would the nurse expect the client to select? Here are the options. Option A, roast beef, gelatin salad, green beans, and peach pie. Option B, chicken salad sandwich, coleslaw, French fries, ice cream. Option C, egg salad on wheat bread, carrots, steaks, lettuce salad, raisin pie. Option D, pork chop, creamed potatoes, corn, and coconut cake. The correct answer is option A, roast beef, gelatin salad, green beans, and peach pie. Roast beef is a high source of heme iron, which is absorbed more efficiently by the body than non-heme sources. Question 66. The nurse is recommending activities for a client with sickle cell anemia to avoid hypoxia. Which activity is most appropriate? Here are the options. Option A, a family vacation in the Rocky Mountains. Option B, chaperoning a local boys' club on a snow skiing trip. Option C, traveling by airplane for business trips. Option D, a bus trip to the Museum of Natural History. The correct answer is option D, a bus trip to the Museum of Natural History. High altitudes, mountains/plains, and extreme cold skiing can trigger a crisis. A low-altitude, indoor bus trip is the safest choice. Question 67. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which of the following would the nurse include in the physical assessment? Here are the options. Option A, palpate the spleen. Option B, take the blood pressure. Option C, examine the feet for petechiae. Option D, examine the tongue. The correct answer is option D, examine the tongue. Vitamin B12 deficiency pernicious anemia is often characterized by a smooth, beefy red tongue, known as glossitis. Question 68. An African American female is suspected of having vitamin B12 deficiency anemia. What body part would be the best indicator for jaundice? Here are the options. Option A, conjunctive of the eye. Option B, soles of the feet. Option C, roof of the mouth. Option D, shins. The correct answer is option C, roof of the mouth. The hard palate roof of the mouth is one of the most reliable sites to assess for jaundice in individuals with dark skin. Question 69. The nurse is conducting a physical assessment on a client with anemia. Which clinical manifestation would be most indicative of the anemia? Here are the options. Option A, BP 146/88. Option B, respirations 28 shallow. Option C, weight gain of 10 pounds in 6 months. Option D, pink complexion. The correct answer is option B, respirations 28 shallow. Tachypnea, increased respiratory rate, is a compensatory mechanism used by the body to increase oxygen intake when hemoglobin is low. Question 70. The nurse is teaching a client with polycythemia vera about complication prevention. Which statement by the client indicates a need for further teaching? Here are the options. Option A, I will drink 500 ml of fluid or less each day. Option B, I will wear support hose when I am up. Option C, I will use an electric razor for shaving. Option D, I will eat foods low in iron. The correct answer is option A, I will drink 500 ml of fluid or less each day. Clients with polycythemia vera should stay well hydrated, usually 3 liters/day, to decrease blood viscosity and prevent clot formation. Question 71. A 33-year-old male is being evaluated for possible acute leukemia. Which of the following would the nurse inquire about as part of the assessment? Here are the options. Option A. The client collects stamps as a hobby. Option B. The client recently lost his job as a postal worker. Option C. The client had radiation for treatment of Hodgkin's disease as a teenager. Option D. The client's brother had leukemia as a child. The correct answer is option C. The client had radiation for treatment of Hodgkin's disease as a teenager. Previous exposure to radiation or chemotherapy for other cancers like Hodgkin's significantly increases the risk of developing acute leukemia later in life. Question 72. An African American client is admitted with acute leukemia. What is the best site for examining for the presence of petechiae? Here are the options. Option A. The abdomen. Option B. The thorax. Option C. The earlobes. Option D. The soles of the feet. The correct answer is option D. The soles of the feet. In dark-skinned clients, petechiae are most easily observed in lighter areas such as the palms of the hands or the soles of the feet. Question 73. A client with acute leukemia is admitted to the oncology unit. Which of the following would be most important for the nurse to inquire? Here are the options. Option A. Have you noticed a change in sleeping habits recently? Option B. Have you had a respiratory infection in the last 6 months? Option C. Have you lost weight recently? Option D. Have you noticed changes in your alertness? The correct answer is option B. Have you had a respiratory infection in the last 6 months? Infection is a major cause of death in leukemia patients due to neutropenia. A history of recent infections can indicate a compromised immune system. Question 74. Which of the following would be the priority nursing diagnosis for the adult client with acute leukemia? Here are the options. Option A. Oral mucous membrane, altered related to chemotherapy. Option B. Risk for injury related to thrombocytopenia. Option C. Fatigue related to the disease process. Option D. Interrupted family processes. The correct answer is option B. Risk for injury related to thrombocytopenia. Thrombocytopenia puts the patient at extreme risk for spontaneous and life-threatening hemorrhage. Preventing injury and bleeding is the priority. Question 75. After the physician performs an amniotomy, the nurse's first action should be to assess the. Here are the options. Option A. Degree of cervical dilation. Option B. Fetal heart tones. Option C. Client's vital signs. Option D. Client's level of discomfort. The correct answer is option B. Fetal heart tones. The priority after the membrane's rupture amniotomy is assessing fetal heart tones to ensure the umbilical cord hasn't prolapsed. Question 76. A vaginal exam determines that the client's cervix is 5 cm dilated with 75% effacement. The client is in which phase of labor? Here are the options. Option A. Active. Option B. Latent. Option C. Transition. Option D. Early. The correct answer is option A. Active. The active phase of the first stage of labor is typically defined by cervical dilation between 4 and 7 cm. Question 77. A newborn with narcotic abstinence syndrome is admitted. Nursing care of the newborn should include. Here are the options. Option A. Teaching the mother to provide tactile stimulation. Option B. Wrapping the newborn snugly in a blanket. Option C. Placing the newborn in the infant seat. Option D. Initiating an early infant stimulation program. The correct answer is option B. Wrapping the newborn snugly in a blanket. Newborns experiencing withdrawal should be kept in a low stimulation environment. Swaddling snugly helps provide comfort and reduces irritability. Question 78. Following the initiation of epidural anesthesia, the nurse should give priority to. Here are the options. Option A. Checking for cervical dilation. Option B. Placing the client in a supine position. Option C. Checking the client's blood pressure. Option D. Obtaining a fetal heart rate. The correct answer is option C. Checking the client's blood pressure. Maternal hypotension is a common side effect of epidural anesthesia, which can lead to decreased placental perfusion. Question 79. The nurse is aware that the best way to prevent postoperative wound infection in the surgical client is to. Here are the options. Option A. Administer a prescribed antibiotic. Option B. Wash your hands for 2 minutes before care. Option C. Wear a mask when providing care. Option D. Ask the client to cover her mouth when she coughs. The correct answer is option B. Wash your hands for 2 minutes before care. Hand hygiene is the single most effective method for preventing the spread of infection and protecting surgical wounds. Question 80. The elderly client is admitted to the emergency room with a suspected fractured hip. Which symptom is the client most likely to exhibit? Here are the options. Option A. Pain. Option B. Misalignment. Option C. Cool extremity. Option D. Absence of pedal pulses. The correct answer is option B. Misalignment. A classic sign of a hip fracture is the shortening and external rotation of the affected leg misalignment. Question 81. The nurse knows that a 60-year-old female client's susceptibility to osteoporosis is most likely related to. Here are the options. Option A. Lack of exercise. Option B. Hormonal disturbances. Option C. Lack of calcium. Option D. Genetic predisposition. The correct answer is option B. Hormonal disturbances. The decrease in estrogen production following menopause is the leading cause of bone density loss in postmenopausal women. Question 82. A 2-year-old is in Bryant's traction for a fractured femur. Which finding indicates the traction is working properly? Here are the options. Option A. The infant no longer complains of pain. Option B. The buttocks are 15 degrees off the bed. Option C. The legs are suspended in the traction. Option D. The pins are secured within the pulley. The correct answer is option B. The buttocks are 15 degrees off the bed. In Bryant's traction, the buttocks must be slightly elevated off the mattress to provide the necessary countertraction. Question 83. Which statement is true regarding balanced skeletal traction? Here are the options. Option A utilizes a stymon pin. Option B requires that both legs be secured. Option C utilizes Kirschner wires. Option D is used primarily to heal the fractured hips. The correct answer is option A. Utilizes a stymon pin. Skeletal traction involves the use of pins like stymon pins or wires inserted directly into the bone for long-term immobilization. Question 84. Immediately following surgery for an open reduction internal fixation of a fractured hip, the nurse should give priority to assessing. Here are the options. Option A. Serum collection Daval drain. Option B. Client's pain. Option C. Nutritional status. Option D. Immobilizer. The correct answer is option A. Serum collection Daval drain. Monitoring for excessive drainage or hemorrhage from the surgical site is the immediate postoperative priority. Question 85. Which statement by a family member indicates an understanding of the nurse's teaching regarding a percutaneous gastrostomy tube? Here are the options. Option A. I must flush the tube with water after feedings and clamp the tube. Option B. I must check placement 4 times per day. Option C. I will report to the doctor any signs of indigestion. Option D. If my father is unable to swallow, I will discontinue the feeding. The correct answer is option A. I must flush the tube with water after feedings and clamp the tube. Flushing the tube after feeding prevents clogging, and clamping the tube prevents the backflow of gastric contents. Question 86. A client is 2 hours post-total knee replacement. Which information requires notification of the doctor? Here are the options. Option A. Bleeding on the dressing is 3 cm in diameter. Option B. The client has a temperature of 100.6 degrees F 38.1 degrees C. Option C. The client's hematocrit is 26%. Option D. The urinary output has been 60 during the last 2 hours. The correct answer is option C. The client's hematocrit is 26%. A hematocrit of 26% is significantly low, suggesting substantial blood loss during or after surgery that may require a transfusion. Question 87. The nurse is caring for a client with a 5-year-old diagnosis of plumbism. Which history is most likely related? Here are the options. Option A. The client has traveled out of the country in the last 6 months. Option B. The client's parents are skilled stained glass artists. Option C. The client lives in a house built in the 1970s. Option D. The client has several brothers and sisters. The correct answer is option B. The client's parents are skilled stained glass artists. Lead plumbism is used in the soldering process of stained glass. If parents are artists, the child may have been exposed to lead dust or fumes. Question 88. Which equipment would assist the client with a total hip replacement with activities of daily living? Here are the options. Option A. High-seat commode. Option B. Recliner. Option C. TENS unit. Option D. Abduction pillow. The correct answer is option A. High-seat commode. A high-seat commode prevents the hip from flexing more than 90 degrees, which is a critical precaution to prevent prosthesis dislocation. Question 89. In anticipation of complications from anesthesia and narcotics in an elderly surgical client, the nurse should. Here are the options. Option A. Administer oxygen via nasal cannula. Option B. Have Narcan naloxone available. Option C. Prepare to administer blood products. Option D. Prepare to do cardioresuscitation. The correct answer is option B. Have Narcan naloxone available. Elderly patients are at higher risk for respiratory depression from narcotics. Naloxone Narcan should be readily available as an antidote. Question 90. A client with a history of abusing barbiturates abruptly stops taking the medication. The nurse should give priority to assessing the client for. Here are the options. Option A. Depression and suicidal ideation. Option B. Tachycardia and diarrhea. Option C. Muscle cramping and abdominal pain. Option D. Tachycardia and euphoric mood. The correct answer is option C. Muscle cramping and abdominal pain. Withdrawal from barbiturates is life-threatening and characterized by severe physical symptoms including muscle spasms, tremors, and abdominal pain. Question 91. During the assessment of a laboring client, the nurse notes that the FHT are loudest in the upper right quadrant. The infant is most likely in which position? Here are the options. Option A. Right breech presentation. Option B. Right occiput anterior presentation. Option C. Left sacral anterior presentation. Option D. Left occiput transverse presentation. The correct answer is option A. Right breech presentation. Fetal heart tones heard in the upper quadrants of the abdomen usually indicate a breech presentation. Question 92. The primary physiological alteration in the development of asthma is. Here are the options. Option A. Bronchial inflammation and dyspnea. Option B. Hypersecretion of abnormally viscous mucus. Option C. Infectious processes causing mucosal edema. Option D. Spasm of bronchial smooth muscle. The correct answer is option D. Spasm of bronchial smooth muscle. While asthma is a chronic inflammatory disease, the acute clinical manifestation is primarily caused by the spasm of bronchial smooth muscle bronchospasm. Question 93. A client with mania is unable to finish her dinner. To help her maintain sufficient nourishment, the nurse should. Here are the options. Option A. Serve high-calorie food she can carry with her. Option B. Encourage her appetite with favorite foods. Option C. Serve her small, attractively arranged portions. Option D. Allow her in the unit kitchen for extra food. The correct answer is option A. Serve high-calorie food she can carry with her. Clients in a manic state are often too hyperactive to sit for meals. Providing high-calorie finger foods allows them to eat while on the move. Question 94. To maintain Bryan's traction, the nurse must make certain that the child's. Here are the options. Option A. Hips are resting on the bed. Option B. Hips are slightly elevated above the bed. Option C. Hips are elevated on a pillow. Option D. Hips and legs are flat on the bed. The correct answer is option B. Hips are slightly elevated above the bed. In Bryan's traction, The child's buttocks should be slightly elevated off the mattress to provide the necessary countertraction. Question 95. Which action by the nurse indicates understanding of the care for a client with herpes zoster? Here are the options. Option A. The nurse covers the lesions with a sterile dressing. Option B. The nurse wears gloves when providing care. Option C. The nurse administers a prescribed antibiotic. Option D. The nurse administers oxygen. The correct answer is option B. The nurse wears gloves when providing care. Herpes zoster shingles is transmissible through direct contact with the lesions. Therefore, gloves must be worn during care. Question 96. A trough level is ordered for a client receiving vancomycin. The nurse should have the blood collected. Here are the options. Option A. 15 minutes after the infusion. Option B. 30 minutes before the infusion. Option C. 1 hour after the infusion. Option D. 2 hours after the infusion. The correct answer is option B. 30 minutes before the infusion. Trough levels are drawn when the medication is at its lowest concentration in the bloodstream, which is typically 30 minutes before the next dose. Question 97. The client using a diaphragm should be instructed to. Here are the options. Option A. Refrain from keeping it in longer than 4 hours. Option B. Keep the diaphragm in a cool location. Option C. Have it resized if she gains 5 pounds. Option D. Have it resized if she has any surgery. The correct answer is option B. Keep the diaphragm in a cool location. Diaphragms should be stored in a cool, dry place to prevent the degradation of the rubber or silicone. Question 98. Which statement by a mother planning to breastfeed indicates the need for additional teaching? Here are the options. Option A. I'm wearing a support bra. Option B. I'm expressing milk from my breast. Option C. I'm drinking 4 glasses of fluid during a 24-hour period. Option D. I'll allow the water to run over my breasts in the shower. The correct answer is option C. I'm drinking 4 glasses of fluid during a 24-hour period. Breastfeeding mothers require significantly more hydration, typically 8 to 10 glasses of fluid per day, to maintain adequate milk production. Question 99. Damage to the Roman 7 cranial nerve results in. Here are the options. Option A. Facial pain. Option B. Absence of ability to smell. Option C. Absence of eye movement. Option D. Tinnitus. The correct answer is option A. Facial pain. Damage to the Roman 7 cranial nerve facial affects facial expression and taste. However, it is frequently confused with the V nerve trigeminal, which causes facial pain. Question 100. A client is receiving pyridium for a urinary tract infection. The client should be taught that the medication may. Here are the options. Option A. Cause diarrhea. Option B. Change the color of her urine. Option C. Cause mental confusion. Option D. Cause changes in taste. The correct answer is option B. Change the color of her urine. Phenazopyridine pyridium is a urinary analgesic that typically turns the urine a bright orange or red color. Question 101. Which of the following tests should be performed before beginning a prescription of Accutane? Here are the options. Option A. Check the calcium level. Option B. Perform a pregnancy test. Option C. Monitor apical pulse. Option D. Obtain a creatinine level. The correct answer is option B. Perform a pregnancy test. Isotretinoin Accutane is highly teratogenic. Female clients must have a negative pregnancy test before starting therapy and use strict contraception. Question 102. Which nursing intervention is most critical during the administration of acyclovir Zovirax? Here are the options. Option A. Limit the client's activity. Option B. Encourage a high carbohydrate diet. Option C. Utilize an incentive spirometer. Option D. Encourage fluids. The correct answer is option D. Encourage fluids. Acyclovir can cause renal damage due to crystal formation in the kidneys. Maintaining high fluid intake is essential to prevent nephrotoxicity. Question 103. A client is admitted for an MRI. The nurse should question the client regarding. Here are the options. Option A. Pregnancy. Option B. A titanium hip replacement. Option C. Allergies to antibiotics. Option D. Inability to move his feet. The correct answer is option A. Pregnancy. The nurse must verify the patient's pregnancy status and the presence of any ferromagnetic metal implants before an MRI. Question 104. The nurse is caring for a client receiving amphotericin B. Which finding indicates toxicity? Here are the options. Option A. Changes in vision. Option B. Nausea. Option C. Urinary frequency. Option D. Changes in skin color. The correct answer is option C. Urinary frequency. Amphotericin B is highly nephrotoxic. Changes in urinary output or frequency can indicate early renal impairment. Question 105. A patient with congestive heart failure complains of dyspnea. Which action is the first the nurse should perform? Here are the options. Option A. Ask the patient to lie down. Option B. Draw blood for ABD. Option C. Send the patient for a chest X-ray. Option D. Check blood pressure. The correct answer is option D. Check blood pressure. When a patient is in respiratory distress, the first priority is to assess vital signs to determine the patient's current clinical stability. Question 106. A patient prescribed nitroglycerin for angina complains of frequent headaches. Which response is correct? Here are the options. Option A. Stop taking the nitroglycerin. Option B. Go to the emergency department. Option C. Headaches are a frequent side effect because it causes vasodilation. Option D. The headaches are unlikely to be related. The correct answer is option C. Headaches are a frequent side effect because it causes vasodilation. Nitroglycerin is a potent vasodilator. Headache is the most common side effect due to the dilation of cerebral blood vessels. Question 107. A patient in remission from colon cancer complains of fatigue and difficulty with concentration. Which explanation accounts for this? Here are the options. Option A. The symptoms may be from anemia caused by chemotherapy. Option B. The patient may be immunosuppressed. Option C. The patient may be depressed. Option D. The patient may be dehydrated. The correct answer is option A. The symptoms may be from anemia caused by chemotherapy. Chemotherapy can cause lingering bone marrow suppression, leading to anemia, which manifests as fatigue and chemobrain difficulty concentrating. Question 108. A clinic patient has a hemoglobin of 10.8 g/dl and is a strict vegetarian. Which advice is appropriate? Here are the options. Option A. The diet provides adequate iron. Option B. The patient should add meat to her diet. Option C. Use iron cookware and eat dark green, leafy vegetables. Option D. Add a cup of coffee or tea to every meal. The correct answer is option C. Use iron cookware and eat dark green, leafy vegetables. Vegetarians can obtain sufficient iron by consuming non-heme iron sources like legumes and leafy greens and using iron cookware. Question 109. Which is the most accurate statement regarding a PRBC transfusion? Here are the options. Option A. Reaction is most likely after infusion is complete. Option B. PRBC are best infused through a 20G catheter. Option C. PRBC should be flushed with 5% dextrose. Option D. A nurse should remain in the room during the first 15 minutes. The correct answer is option D. A nurse should remain in the room during the first 15 minutes. The first 15 minutes are the most critical for identifying life-threatening acute hemolytic reactions. Question 110. Which patient at triage should be assigned the highest priority? Here are the options. Option A. Patient with low-grade fever and myalgias. Option B. Patient unable to bear weight on the left foot. Option C. Patient with abdominal and chest pain after a spicy meal. Option D. Child with a 1-inch bleeding laceration on the chin. The correct answer is option C. Patient with abdominal and chest pain after a spicy meal. Chest pain must always be treated as a potential myocardial infarction until proven otherwise, making it the highest triage priority. Question 111. A patient has a calcium level of 6.0 mg/dl. Which symptom would you not expect to see? Here are the options. Option A. Numbness in hands and feet. Option B. Muscle cramping. Option C. Hypoactive bowel sounds. Option D. Positive CH Fostex sign. The correct answer is option C. Hypoactive bowel sounds. Hypocalcemia normal 8.5-10.5 causes neuromuscular irritability and hyperactive bowel sounds. Hypoactive sounds are seen in hypercalcemia. Question 112. A patient has an NG tube attached to low suction. Which ABG result might be expected? Here are the options. Option A. pH 7.52, PCO2 54 mmHg. Option B. pH 7.42, PCO2 40 mmHg. Option C. pH 7.25, PCO2 25 mmHg. Option D. pH 7.38, PCO2 36 mmHg. The correct answer is option A. pH 7.52, PCO2 54 mmHg. Loss of gastric acid via suctioning leads to metabolic alkalosis, elevated pH with a compensatory increase in PCO2. Question 113. A patient scheduled for surgery is taking a high dose of warfarin. The nurse anticipates which action? Here are the options. Option A. Draw blood for patient and INR level. Option B. Administer vitamin K. Option C. Draw blood for type and cross-match. Option D. Cancel the surgery immediately. The correct answer is option A. Draw blood for patient and INR level. The surgeon needs to know the patient's current coagulation status patient/INR to determine if it is safe to proceed with the procedure. Question 114. Which of the following laboratory results are abnormal? Select all that apply. Here are the options. Option A. Hemoglobin 10.4 g/dl. Option B. Total cholesterol 340 mg/dl. Option C. Total serum protein 7.0 g/dl. Option D. A1C 5.4%. The correct answer is option B. Total cholesterol 340 mg/dl. A cholesterol level of 340 is significantly elevated, normal 200. Hemoglobin 10.4 is also low, normal 12-16. Question 115. Which statement about juvenile idiopathic arthritis is most accurate? Here are the options. Option A. Poor chance of recovery without deformity. Option B. Most progress to adult RA. Option C. Non-steroidal anti-inflammatory drugs are the first choice. Option D. Physical activity should be minimized. The correct answer is option C. Non-steroidal anti-inflammatory drugs are the first choice. NSAID are the primary first-line treatment to manage the inflammation and pain associated with juvenile idiopathic arthritis. Question 116. A child has a puncture wound and suspected osteomyelitis. Which action is done immediately before the antibiotic is started? Here are the options. Option A. The admission orders are written. Option B. A blood culture is drawn. Option C. A CBC with differential is drawn. Option D. The parents arrive. The correct answer is option B. A blood culture is drawn. Cultures must always be obtained before the first dose of antibiotics is administered to ensure accurate identification of the pathogen. Question 117. A 2-year-old child refuses to walk and has a swollen leg. Which does the nurse suspect? Here are the options. Option A. Possible fracture of the tibia. Option B. Bruising of the gastrocnemius. Option C. Possible fracture of the radius. Option D. No anatomic injury. The correct answer is option A. Possible fracture of the tibia. Swelling and refusal to bear weight in a toddler's leg are classic indicators of a toddler's fracture or tibial fracture. Question 118. Which information should the nurse provide to the parents of a child with cerebral palsy? Here are the options. Option A. Regular screening is important for secondary delays. Option B. CP is caused by injury to upper motor neurons. Option C. Milestones will require no intervention. Option D. Outdoor activities are prohibited. The correct answer is option B. CP is caused by injury to upper motor neurons. Cerebral palsy is a motor dysfunction disorder resulting from permanent, non-progressive damage to the upper motor neurons. Question 119. Which statement about Duchenne's muscular dystrophy is most accurate? Here are the options. Option A. Daughters have 50% chance as carriers, sons 50% chance of disease. Option B. Both have a 50% chance of developing the disease. Option C. Each child has a 25% chance of developing it. Option D. Sons only have a 25% chance of developing it. The correct answer is option A. Daughters have 50% chance as carriers, sons 50% chance of disease. Duchenne's is an X-linked recessive disorder. A carrier mother has a 50% chance of passing the affected X to her son's disease or daughter's carrier. Question 120. Mrs. Shua, a 78-year-old client, is admitted with the diagnosis of mild chronic heart failure. Which lung sound does the nurse expect to hear? Here are the options. Option A. Stridor. Option B. Crackles. Option C. Wheezes. Option D. Friction rubs. The correct answer is option B. Crackles. Crackles rails are the classic breath sound associated with heart failure, caused by fluid in the small airways and alveoli. Question 121. Patrick, hospitalized following a myocardial infarction, asks why he is taking morphine. The nurse explains that morphine. Here are the options. Option A. Decreases anxiety and restlessness. Option B. Prevents shock and relieves pain. Option C. Dilates coronary blood vessels. Option D. Helps prevent fibrillation. The correct answer is option B. Prevents shock and relieves pain. Morphine is the drug of choice in MI because it relieves severe pain, reduces anxiety, decreasing sympathetic workload, and reduces preload/afterload. Question 122. Which of the following should the nurse teach the client about the signs of digitalis toxicity? Here are the options. Option A. Increased appetite. Option B. Elevated blood pressure. Option C. Skin rash over the chest and back. Option D. Visual disturbances such as seeing yellow spots. The correct answer is option D. Visual disturbances such as seeing yellow spots. Digitalis tegixin toxicity commonly presents as gastrointestinal distress and visual changes, particularly yellow-green halos or spots. Question 123. Nurse Tricia teaches a client with heart failure to take oral furosemide in the morning. The reason for this is to help. Here are the options. Option A. Retard rapid drug absorption. Option B. Excrete excessive fluids accumulated at night. Option C. Prevent sleep disturbances during the night. Option D. Prevention of electrolyte imbalance. The correct answer is option C. Prevent sleep disturbances during the night. Taking diuretics in the morning prevents nocturia, frequent nighttime urination, which would otherwise disturb the client's sleep. Question 124. What would be the primary goal of therapy for a client with pulmonary edema and heart failure? Here are the options. Option A. Enhance comfort. Option B. Increase cardiac output. Option C. Improve respiratory status. Option D. Decrease peripheral edema. The correct answer is option B. Increase cardiac output. By increasing cardiac output, the heart pumps more effectively, which reduces the backup of fluid into the lungs' pulmonary edema. Question 125. Nurse Linda is monitoring a client with decerebrate posturing. Which of the following is a characteristic of this type of posturing? Here are the options. Option A. Upper extremity flexion with lower extremity flexion. Option B. Upper extremity flexion with lower extremity extension. Option C. Extension of the extremities after a stimulus. Option D. Flexion of the extremities after stimulus. The correct answer is option C. Extension of the extremities after a stimulus. Decerebrate posturing involves the rigid extension of all four extremities and is usually a sign of severe brainstem injury. Question 126. Nurse Betty informs a client taking Cascara Sagrada that which of the following may be experienced as a side effect? Here are the options. Option A. GI bleeding. Option B. Peptic ulcer disease. Option C. Abdominal cramps. Option D. Partial bowel obstruction. The correct answer is option C. Abdominal cramps. Cascara Sagrada is a stimulant laxative that can cause significant abdominal cramping as it increases peristalsis. Question 127. Dr. Marquez orders a continuous Roman 4 nitroglycerin infusion for a client with MI. Which is the most essential nursing action? Here are the options. Option A. Monitoring urine output frequently. Option B. Monitoring blood pressure every 4 hours. Option C. Obtaining serum potassium levels daily. Option D. Obtaining an infusion pump for the medication. The correct answer is option D. Obtaining an infusion pump for the medication. Roman 4 nitroglycerin is a potent vasodilator and must be administered via a volumetric infusion pump to ensure precise dosing and prevent hypotension. Question 128. During the second day of hospitalization for MI, which of the following is an expected outcome? Here are the options. Option A. Able to perform self-care without pain. Option B. Severe chest pain. Option C. Can recognize the risk factors of MI. Option D. Can participate in cardiac rehab walking program. The correct answer is option C. Can recognize the risk factors of MI. By the second day, the patient should be hemodynamically stable and ready to begin education on lifestyle modifications and risk factor reduction. Question 129. A client is admitted with a right-sided brain attack. In caring for this client, the nurse should plan to. Here are the options. Option A. Apply elastic stockings. Option B. Use hand roll and extend the left upper extremity on a pillow. Option C. Use a bed cradle to prevent dorsiflexion. Option D. Do passive range of motion exercise. The correct answer is option B. Use hand roll and extend the left upper extremity on a pillow. Supporting the affected left side with hand rolls and pillows helps prevent contractures and maintains functional alignment. Question 130. A client has returned to the unit after a left nephrectomy. Which of the following is the highest priority? Here are the options. Option A. Hourly urine output. Option B. Temperature. Option C. Able to turn side to side. Option D. Able to sip clear liquid. The correct answer is option A. Hourly urine output. Monitoring hourly urine output is critical to ensure the remaining kidney is functioning adequately and to detect early signs of shock. Question 131. During precardiac catheterization teaching, Nurse Jerry should inform the client that the primary purpose of the procedure is. Here are the options. Option A. To determine the existence of CHD. Option B. To visualize the disease process in the coronary arteries. Option C. To obtain the heart chamber's pressure. Option D. To measure oxygen content. The correct answer is option B. To visualize the disease process in the coronary arteries. The primary diagnostic goal of cardiac catheterization is to visualize blockages or narrowing in the coronary arteries via angiography. Question 132. During the first several hours after a cardiac catheterization, it is essential for the nurse to. Here are the options. Option A. Elevate the client's bed at 45 degrees. Option B. Instruct the client to cough and deep breathe. Option C. Frequently monitor the client's apical pulse and blood pressure. Option D. Monitor temperature every hour. The correct answer is option C. Frequently monitor the client's apical pulse and blood pressure. Frequent vital signs and assessment of the insertion site for bleeding/hematoma and peripheral pulses are the priorities post-procedure. Question 133. Kate, who had mitral valve replacement, experiences continuous bleeding from the incision. Which agent should the nurse prepare? Here are the options. Option A. Protamine sulfate. Option B. Quinidine sulfate. Option C. Vitamin C. Option D. Coumadin. The correct answer is option A. Protamine sulfate. Protamine sulfate is the specific antidote used to reverse the effects of heparin, which is often used during cardiac surgery. Question 134. To promote good dental care in clients with endocarditis, the teaching plan should include the proper use of a. Here are the options. Option A. Dental floss. Option B. Electric toothbrush. Option C. Manual toothbrush. Option D. Irrigation device. The correct answer is option C. Manual toothbrush. A soft manual toothbrush is preferred. Devices like water picks or floss can cause gingival trauma and bleeding, leading to bacteremia. Question 135. After a long leg cast is removed, the male client should. Here are the options. Option A. Cleanse the leg by scrubbing with a brisk motion. Option B. Put leg through full range of motion twice daily. Option C. Report any discomfort or stiffness to the physician. Option D. Elevate the leg when sitting for long periods of time. The correct answer is option D. Elevate the leg when sitting for long periods of time. After cast removal, the limb is prone to edema due to the loss of support. Elevation helps manage swelling. Question 136. While performing a physical assessment of a client with gout, the nurse should assess for additional tophi on the. Here are the options. Option A. Buttocks. Option B. Ears. Option C. Face. Option D. Abdomen. The correct answer is option B. Ears. Alpha-urate crystals commonly deposit in the outer ear pinna, as well as in the joints of the hands and feet. Question 137. Demonstration of crutch walking with a tripod gait was understood when the client places weight on the. Here are the options. Option A. Palms of the hands and axillary regions. Option B. Palms of the hand. Option C. Axillary regions. Option D. Feet, which are set apart. The correct answer is option B. Palms of the hand. In crutch walking, weight should be supported by the palms of the hands, never the axilla, to prevent brachial plexus nerve damage. Question 138. A client with RA states he only has no pain when lying still. During the convalescent stage, the nurse should encourage. Here are the options. Option A. Active joint flexion and extension. Option B. Continued immobility until pain subsides. Option C. Range of motion exercises twice daily. Option D. Flexion exercises 3 times daily. The correct answer is option C. Range of motion exercises twice daily. ROM exercises are essential to prevent joint ankylosis, permanent stiffening, and maintain as much function as possible. Question 139. Following spinal surgery, the nurse should perform which assessment? Here are the options. Option A. Observe the client's bowel movement and voiding patterns. Option B. Log roll the client to prone position. Option C. Assess the client's feet for sensation and circulation. Option D. Encourage client to drink plenty of fluids. The correct answer is option C. Assess the client's feet for sensation and circulation. Assessing neurovascular status, sensation, and circulation in the extremities is vital to ensure no spinal cord or nerve damage occurred. Question 140. During the diuretic phase of acute renal failure, the client must be assessed for signs of. Here are the options. Option A. Hypovolemia. Option B. Renal failure. Option C. Metabolic acidosis. Option D. Hyperkalemia. The correct answer is option A. Hypovolemia. In the diuretic phase, the kidneys can produce urine but cannot concentrate it, leading to massive fluid loss and potential hypovolemic shock. Question 141. Which of the following tests differentiates mucus from cerebrospinal fluid, CSF, in nasal drainage? Here are the options. Option A. Protein. Option B. Specific gravity. Option C. Glucose. Option D. Microorganism. The correct answer is option C. Glucose. CSF contains glucose, whereas normal nasal mucus does not. A simple bedside glucose test, dextrosticks, can help identify a CSF leak. Question 142. What is the primary cause of tonic-clonic seizures in adults older than 20 years? Here are the options. Option A. Electrolyte imbalance. Option B. Head trauma. Option C. Epilepsy. Option D. Congenital defect. The correct answer is option B. Head trauma. While many factors exist, head trauma is a leading cause of acquired seizure disorders in the adult population. Question 143. What is the priority nursing assessment in the first 24 hours after admission of a client with a thrombotic CVA? Here are the options. Option A. Pupil size and pupillary response. Option B. Cholesterol level. Option C. Echocardiogram. Option D. Bowel sounds. The correct answer is option A. Pupil size and pupillary response. Monitoring pupillary response is a key part of the neurological assessment to detect changes in intracranial pressure or worsening stroke status. Question 144. Which discharge instruction is most appropriate for a client with multiple sclerosis? Here are the options. Option A. Practice using mechanical aids for future disabilities. Option B. Follow health habits to change the disease course. Option C. Keep active, use stress reduction, and avoid fatigue. Option D. Accept a quiet and inactive lifestyle. The correct answer is option C. Keep active, use stress reduction, and avoid fatigue. MS is characterized by exacerbations. Maintaining a balance of activity and rest while avoiding stress/fatigue helps prevent flare-ups. Question 145. What is the early indicator of hypoxia in the unconscious client? Here are the options. Option A. Cyanosis. Option B. Increased respirations. Option C. Hypertension. Option D. Restlessness. The correct answer is option D. Restlessness. Restlessness and agitation are the earliest signs of hypoxia as the brain responds to decreasing oxygen levels. Question 146. A client is experiencing spinal shock. The nurse should expect the function of the bladder to be. Here are the options. Option A. Normal. Option B. Atonic. Option C. Spastic. Option D. Uncontrolled. The correct answer is option B. Atonic. Spinal shock results in a temporary loss of all reflex activity below the injury, leading to an atonic flaccid bladder and urinary retention. Question 147. During which stage is the action of a carcinogen considered irreversible? Here are the options. Option A. Progression stage. Option B. Initiation stage. Option C. Regression stage. Option D. Promotion stage. The correct answer is option A. Progression stage. The progression stage is characterized by increased growth rate, invasiveness, and metastases. At this point, the process is irreversible. Question 148. Among the following components of a thorough pain assessment, which is the most significant? Here are the options. Option A. Effect. Option B. Cause. Option C. Causing factors. Option D. Intensity. The correct answer is option D. Intensity. Pain is subjective. The client's self-report of pain intensity using a scale is the most significant component for directing treatment. Question 149. A 65-year-old female is experiencing a flare-up of pruritus. Which action could aggravate the condition? Here are the options. Option A. Sleeping in a humidified environment. Option B. Daily baths with fragrance soap. Option C. Using clothes made from 100% cotton. Option D. Increasing fluid intake. The correct answer is option B. Daily baths with fragrance soap. Fragrant soaps and frequent hot baths dry the skin and cause irritation, significantly worsening pruritus itching.